What do all these terms you just saw have in common? All of them are commonly used when talking about people who have developmental disabilities. So you're probably asking yourself, what is a developmental disability? Individuals with mental retardation, autism, cerebral palsy, or other similar long-term disabilities may be considered to have a developmental disability. A disability involves personal limitations that can place someone at a disadvantage when attempting to function in society. People with developmental disabilities may not always learn as quickly as others or express themselves clearly. Others may have limited ability to take care of their physical needs or experience limited mobility. And many people have more than one disability. It's difficult to define the limits some people face. While they may face a more challenging future than some, they can still enjoy a full and active life. With our encouragement, understanding, and willingness, we can help increase their opportunities for joining in the life of the community. Through the years, there have been several myths about people with developmental disabilities.
All people who have developmental disabilities have mental retardation.
Not all people with developmental disabilities have mental retardation. For instance, someone with cerebral palsy doesn't necessarily have mental retardation.
People with developmental disabilities can't live independently.
With living supports such as job training assistance, medical health follow-up, personal care assistance, or financial help, people can live independently.
People with developmental disabilities prefer to spend time around other people with disabilities.
It's natural to enjoy activities with your peers and with people who share common interests. Likewise, people with developmental disabilities enjoy spending time with people who have similar interests. This includes being with someone who doesn't have a disability. When people of different backgrounds and abilities learn, work, and socialize together, everyone benefits. Now, what about the specific developmental disability called mental retardation?
Adults with mental retardation are childlike.
Adults with mental retardation are not children and should not be treated as children. The pace of someone's development is influenced by many factors, including their relationships with family, friends, school, and work, and opportunities for growth and social development.
People with mental retardation are all mentally ill.
Mental retardation and mental illness are totally different. They are two distinct diagnoses. However, someone with mental retardation can also have mental illness. Mental illness is a medical condition that can affect an individual's thinking, mood, and behavior. It usually doesn't affect a person's intelligence. We'll talk about the definition of mental retardation a little later.
People with mental retardation can't go to school because they don't know what's going on.
People with mental retardation can and do go to school. While people with mental retardation may learn more slowly than others, they have many of the same hopes, fears, challenges, and needs as anyone else. People with mental retardation have talents and abilities that can be developed through individualized education plans and job coaching.
I've heard of mental retardation, but what exactly is it?
That's a good question. To find our answer, let's look at a definition from the American Association on Mental Retardation, commonly known as AAMR. They define mental retardation like this. Mental retardation is a disability characterized by significant limitations both in intellectual functioning and in adaptive behavior expressed in conceptual, social, and practical adaptive skills. This disability originates before the age of 18.
All right, that's a mouthful, but I'm still confused. What does it all mean?
One simple way of looking at it is to consider three different things: intellectual functioning, adaptive behavior, and age. All three of these come together to describe what we know as mental retardation. First, let's talk about intellectual functioning. This is the ability to learn, reason, solve problems, and understand. IQ tests are a long way from perfect, and they don't tell you very much by themselves. However, they're still a commonly accepted way to measure intellectual functioning. So question number one is, does the person have a substantially low IQ? The next part of the definition is limitations in adaptive behavior. Well, what does that mean? Adaptive behavior includes the conceptual, social, and practical skills that have been learned in order to function in everyday life situations. For example, learning how to handle money, knowing how to read a menu in a restaurant, obeying laws, following rules, taking medication, preparing meals, keeping house, are all adaptive behavior skills. Adaptive behavior means skills that are typical for a person of a certain age. The adaptive skills of a 5-year-old would be very different than that of a 25-year-old. And remember, the last part of the definition originates before the age of 18. This simply means that for someone to have mental retardation, whatever happened in the person's life to change their course of development had to happen before the age of 18.
What causes mental retardation?
Mental retardation has a variety of causes that can occur before, during, or after birth. Those occurring before birth include genetic problems, poor prenatal care, or exposure of the fetus to toxic elements such as drugs or alcohol. Let's take a few minutes to discuss some of the other causes of mental retardation. Alcohol use during pregnancy can result in the baby developing fetal alcohol syndrome. Fetal alcohol syndrome results from excessive consumption of alcohol during pregnancy, and it's the most common preventable cause of mental retardation. Malnutrition during pregnancy is also a common cause of mental retardation in developing countries where women don't have a balanced diet. Protein and nutrients are essential for the growth and development of the mind and body of the fetus. Infectious diseases during childhood or pregnancy, which in most cases are easily preventable through immunization, can also cause mental retardation due to complications. Some examples of infectious diseases include measles, chickenpox, or whooping cough. Another cause of mental retardation is deprivation and neglect. All children need emotional security and stimulation to develop. When this doesn't happen, it may result in a permanent disability. Physical trauma to the brain can also cause mental retardation. Brain damage can result from accidental blows to the head, near drowning, and child abuse. Other causes can include problems during birth, such as premature birth, low birth weight, or stress to the baby when there's a loss of oxygen.
People with mental retardation are all alike, aren't they?
The answer to that question is no. The effects of mental retardation vary considerably among people, just as the range of abilities vary considerably among people who don't have mental retardation. Each and every one of us has our own unique abilities, different preferences, choices, relationships, and the need for assistance. Sometimes people feel uncomfortable when interacting with someone who's different from them. It's often said, it takes a special person to work with people with disabilities. Well, the fact is, you don't need to be special or have any specialized education. Any person who is patient and kind and has a sincere interest in people can have quality interactions. One important key to support for any of us is to have the chance to be valued by others.
I've been around people with disabilities before. I usually try to avoid them because I don't know what to say or do. How do I interact with someone with a disability?
In your interactions, seek out ways you can help promote the person's value. Here are some suggestions that will put you and the other person more at ease. Talk directly to the person, maintaining eye contact. Encourage the person to speak up for himself or to give her own opinion. Ask the person if they need assistance rather than assuming that they need it. For example, If the person is reaching for an item in the kitchen cabinet and you notice they're having trouble, don't assume they need you to get the item for them. Ask the person if they need your help. Use a normal tone of voice. A normal tone of voice is not loud or a tone that tries to overpower the person. It's the voice you use in normal conversation. If you don't understand what the person is trying to tell you, repeat back what you thought they said. If you still don't understand, tell them. Ask the person if they would please repeat what they were trying to say. Don't assume that a person with a disability has other disabilities as well. What I mean is, don't assume that someone who is blind can't hear, or that someone who can't hear also can't speak. In social settings, treat the person like you would anyone else. Don't avoid them, but don't be overly attentive either. Being overly attentive can call attention to the person's disability instead of the person. Be genuine and honest. If you're not sure what to talk about, choose the weather or some other general topic. It doesn't really matter what you talk about as long as you're opening yourself up to the person and including them. And one final thing to remember. Avoid portraying people with disabilities as superhuman or courageous, or on the other hand, as poor and unfortunate. People with disabilities do not want to be, nor should they be, measured against a separate set of expectations. They have the right to experience life to the fullest. Life is richest when it's spent in the company of others, whether that's at home, work, at school, or at church. With encouragement, understanding, and willingness of others to help people with disabilities, we can increase the person's life experiences and opportunities for becoming a part of their community.
This message brought to you by the Key Training Center.